from Walfinch, and today Wellness with Walfinch has brought us to Buckinghamshire, where I'll be interviewing Dr. Nik, who's the founder of the Doctor's Lounge. So Dr. Nik, I hear lots about bone density. What do I need to know about bone density and how do I improve it?
That's a good question. So bone density, for us, it's really an assessment of risk of fractures. That's kind of or breaks, as we should call it. The risk of breaking bones in the future. And we talk mainly about the hip joint. That's generally what we're seeing a lot of. And the problem is that some people are at risk, right? So they have a low bone density. And density, for those that don't know, is the kind of, the meat on the bones, right? How strong are the bones? When we talk about low bone density or a condition called osteoporosis, imagine like you have a solid structure as a bone, right? But bone has little holes in it, okay? And it looks like a little bit of a sponge. Imagine lots and lots of holes, right? So you're getting all these little holes within the bone. It's then at risk of breaking, right? So the idea is we want our bones to be as strong as possible. Now, most people don't realize that bone is a living organism, right? So it makes and breaks, okay? So constantly you've got cells that make more bone and constantly you've got cells that break the bone. And it's this balance that you're trying to achieve. So we often, in a clinic room, I'll show the seesaw, right? We want to get those cells working at the optimum.
Yeah.
And there are ways that we do that. So yes, there's medications, but if we stay away from medication for a minute, if we found that someone had low bone density, we'd be starting to say, right, how can we promote the growth of the bone? And that will be things like calcium. You will have heard of people drinking milk, when they're kids.
Yep.
Milk's not so important for adults as they get older, and there's a whole piece around, is milk good for adults? And I won't get into that. But getting calcium, forget about where it's come from. And there are some, calcium calculators that you can jump onto on the internet, type in calcium calculator, and it will tell you how much you need and where can you get it from.
Yeah? Right.
Really easy. The second thing is vitamin D, and the two of those things work, and there's a complex pathway which sometimes I have to forget and have to go back and read myself, but it's a complex pathway around vitamin D and calcium coming together to provide you with what you need to have strong bones. So making sure your vitamin D levels are right, making sure your calcium levels are right, and we can assess for these on blood tests. And then the other bit that you can do is to actually look at bone density, right? So you can look at the bones on an X-ray, something called a DEXA scan. So it's a bit like having an X-ray, very simple, and they can get assessment of bone density. And at certain values, you would say, right, this person needs more vitamin D, or this person needs medication for their bone density. There are a number of reasons why people might have a low bone density. Okay, so alcohol, unfortunately, is doctors are constantly telling people to drink less. Smoking, another impact. Being underweight, but also being overweight. Both of those can have an impact. If I remember right, I can't remember the finger, but women are more likely to develop it. But also the menopause. The menopause is the time where females, their hormones drop and they're at risk of osteoporosis or low bone density, especially if that happens earlier. For men, testosterone deficiency has an impact mainly on the muscles, but it does have an impact on the bones itself. So looking at testosterone levels for men, and then lack of exercise, so poor exercise levels and poor nutrition, general nutrition is thought to have an impact, but certainly poor exercise. Now, with exercise, it's an interesting one because, as you've heard me talk about stability all the time, it's really about making sure that people have strong bones in that kind of pelvis, lower body region.
Yeah.
Because we know that the risk of fractures or breaks in the hip are high, but we also know that it's because people fall.
Yeah.
Right? So coming back to the piece that we've done before around stability is get stable, don't break.
Yeah.
Don't fall, then don't break.
Yeah.
Right? But if you're going to fall, there's always a risk. Make sure your bones are as healthy as they can be. So we do a lot of kind of health screening, and in our health screening, one of the pieces is bone density.
Yeah.
How strong are your bones? Let's get an assessment of, do we need to be investigating it? Do we need to treat it? Or do we need to just get a better lifestyle change?
Fantastic.